right, we're going to go on ahead and get started, everybody. I would like to welcome you all to the Secret Sauce to Fixing Healthcare, hosted by Espen and sponsored by Totem. This webinar will offer you the understanding of why quality is so important to fixing your healthcare. We have a great lineup of speakers. We also have a great lineup of additional events coming up. I'd like to encourage you to go on ahead and register for the October 29th event. Fiduciary responsibility does not have to keep you up at night. You can keep the night ears at bay and join us for this discussion. And if you would like to join us, please feel free to just send me over a chat or a Q&A, and I will get you registered for this event. Next, I would like to introduce Jeff. Jeff is the VP of Sales and Finance at Totem. He is dedicated to fixing healthcare for large employers. He's been with Totem for 8 years. As the Health Rosetta Benefits Association advisor, he's committed to an industry-leading standard of transparency and fiduciary responsibility. Using data analytics and proven practices, he designs healthcare plans that can reduce healthcare spending by 20% or more while achieving better health outcomes. And I think that is very much the point to this is we don't only want to reduce our spending, we want to increase our quality and make sure that our employees are well taken care of and have access to the best healthcare possible. So with that, Jeff, I'm going to turn this over to you.
Well, good morning, everyone. Let me share my screen. Sure. Okay. Can everyone see my screen?
Yes.
Okay. Well, good morning. Glad to be here with Espen. They're a great organization. If you are not a member, certainly consider it. And today we are pleased to be sharing three panelists from three phenomenal companies. As Michelle alluded to, Totem is a benefits consulting firm in Atlanta, and I would say we're one of the things that makes us unique is that we are laser focused on quality, and these three vendors are as well. And we are happy that they can join us today and share a little bit more about what exactly they do, what their approach to quality really looks like, and then we'll have time for an open discussion about just quality in general in the industry as well. So first is Annalie Roding, who is a physician assistant and clinical quality manager with Eden Health. Second, Wally Goma, who is the co-founder and CEO of Simple Pay Health, and then Sean Rutledge, who is the president of sales from Edison Healthcare. And before we get started with them, I just want to share a little bit more about how and why we ended being so focused on quality. So when we talk about the problems with healthcare, it really comes down to these three villains. The first being utilization. When you survey doctors, they'll tell you that about 21% of all care isn't necessary. It's not clinically appropriate. It's just over treatment, over testing. And we tend to think it's even higher than that, and even higher in some of the really expensive, complex procedures like spinal fusion. Then there's price. Even within a PPO network, there's tremendous variation in terms of price. You can get an in-network hip replacement for $25,000 or $75,000. And by the way, the less expensive one is usually better quality. So it's just a really inefficient market. And then, in terms of quality, the traditional PPO network really isn't doing anything to get people to the better providers and the better facilities. And so when you look at your utilization relative to quality, it's really just a scatter plot. A third of your people are going to the top third of providers. And the really interesting thing about quality is that if you just focus on that one piece, everything else really falls in line. And we're not talking about just a small cost reduction. We're talking about a 30 to 40% delta in the total cost of each episode of care. Not only is the unit cost generally on the lower end, but the better providers are doing appropriate care, and so they're not overdoing expensive procedures, over testing, and they're not over prescribing drugs, leading to an overall episode cost that's much lower, and all the while your employees have been better taken care of. So just a quick overview of kind of each of these three vendors. Eden Health is virtual direct primary care. We think of them as telemedicine on steroids. So you have more time with your primary care providers. You're reaching those people that are a little bit younger, that really could care less about going to a brick and mortar doctor's office ever again. You have more comprehensive care. It's the same care team. They're integrating behavioral health. And ultimately you get less ER visits, less urgent care visits, and less specialist visits. SimplePay is unique because they've taken this thesis that quality is really all that matters, and they've embedded it into the plan design. And because it's embedded, they're going from a single digit utilization of a traditional health medical advocacy program to over 50% utilization of top quality providers, which is leading to a 24% average savings, which is huge. That's reference-based pricing stuff right there. And then Edison, I think of them as a high quality boutique PPO network that covers all your expensive, complex care, making sure that it's done right, the right time, it's the right diagnosis from the best providers in the nation. And what they're finding is that 30% of the time, a cancer diagnosis is wrong. And that obviously affects members. And 60% of the time, a spine surgery is done when it wasn't really needed in the first place. And the best part of that is it's Amex Platinum level member experience the whole way, and with no out of pocket. So with that, I'll kick it off to each of the vendors, who are just going to give a 5 or so minute overview, and then we can have some time for discussion at the end. Feel free to ask questions along the way, or you can share them at the end. Wally?
Okay, great. Well, good morning, everyone. And thank you, Jeff, for that table set. It's great to be alongside both Eden and Edison. We have a lot more in common than just the fact that health is in our name. And really, all of us are all trying to strive for the same outcome in terms of quality. So we're fortunate to have been able to develop one of the country's largest claim and quality data sets. It's data on 130 million patients, over 30 billion claim records constantly being refreshed. And to kind of reiterate what Jeff shared, it's very obvious that when patients lean into high quality providers along a clinical pathway, it's producing an over $5,000 lower cost of care per patient per year. What we realized as we started to really dig into this several years ago is a lot of the strategies used by our industry to really, look for quality and to design around that were really the opposite of what we should have been doing. 2 quick examples on that. If you look at hospital services, we're always trying to find out what are the best hospitals in our community, but we really should have been looking at hospital service lines. We should have been going a layer deeper. One hospital may be the best at cardiology, not the place to go for orthopedics, but the hospital across the street could be the best at oncology and not the place to go for obstetrics, as an example. And the second thing is we prescribe to the thesis that healthcare is a team sport, and it doesn't do us a lot of good to go to the best quality service lines if that's not combined with the best physicians that are practicing high quality, efficient care and are actually referring and admitting their patients to those service lines. But when we do, we see this as the greatest untapped opportunity in the employer-sponsored space is to leverage quality. I think, Jeff, if we go to the next slide, our belief is the bigger challenge is not really knowing where to go. We have, great knowledge as an industry on, for every geography, every hospital, every doctor in the country. the bigger challenge is how are we going to get plan participants to be engaged enough and motivated enough to take advantage of this information and to sort of lean into quality. And as we have in our other businesses, we are involved in a navigation business that has, several million patients that we help to navigate. It became exceedingly clear to us that plan design was really the barrier that was preventing individuals from behaving like a consumer. And if you advance to the next slide, if we could really design health insurance from a consumer journey perspective to work like any other consumer industry, where gone would be things like deductibles and coinsurance that really doesn't give the patient, the consumer, the opportunity to see a price tag. If we could eliminate all the confusing paperwork, things like bills and EOBs that nobody understands, and instead replace it with a single monthly statement where that price would match the actual price tag seen before the procedure was performed, what we started to observe is that when we put that consumer model in place, without even asking plan participants to do anything, they were naturally making decisions towards higher quality, and it was resulting in dramatically lower costs for both the plan sponsor and the plan participants. And if we go to the next slide, we like to use knee surgery as the example. If you can imagine how complicated that is in today's current insurance plan design and payment strategy with deductibles and copays, imagine replacing that with exactly the kind of information we should have put in plan participants' hands years ago. To be a consumer, you've got to have information on quality and on price. Obviously, as it relates to quality, we like to say nobody needs to go to open enrollment to know that 5 stars is better than 3 stars. Consumers know that intuitively. And rather than using deductibles and coinsurance where the individual never understands what their out-of-pocket responsibility would be in advance, we have truly replaced that model with price tags for every covered medical and pharmacy service, with a strategy of setting lower price tags to those providers that we pre-identify deliver the highest level of quality. We know that as a patient leans in, it's on average producing a $5,000 lower cost per patient per year. And on the next slide, we had to get rid of all the confusing bills and EOBs. Individuals won't behave like a consumer unless we create a consumer journey and a process that works like everything else. If you buy a television with your credit card, the retailer is paid in full by the bank, by the credit card company, and the consumer gets one statement and from their bank and the amount better match. We are rolling this out nationally in partnership with CVS Health, the Aetna and Meritain organization. And when a patient shows their ID card to the provider is paid their contracted rate in full, and there is never a need for bills and EOBs from providers ever again. Providers have a contracted rate in the network. Why do we make them chase the patient for some of those dollars and get the rest from insurance administrator? Instead, if you go to the next slide, we pay the provider their contracted allowed rate in full. It eliminates bills and EOBs forever. Patients get one monthly statement. The amount on that statement will match the price tag they saw earlier. And we've even integrated some very nice financing models where patients can pay their balance out over time at a 0% interest rate to the patient. It does not become an employer liability. And then lastly, on the final slide, if I could go back in time in my career, I've been a financial officer of a hospital system, president for one of the medical carriers. If I had one do-over in my career, this would have been the one. We've always known as an industry that quality mattered, and we wanted individuals to make sound consumer-based decisions. How could you be a consumer if you don't have the price tag for something in advance? And our strategy, our design strategy of eliminating deductibles and coinsurance with a price tag for every healthcare and pharmacy service has created more engagement and steerage towards high quality and ultimately better outcomes and lower cost for employers. I would close with a final comment about quality, that none of us would ever buy $10 gasoline for our car if it was $2 across the street. In health insurance, we make those decisions every day because we've never had the price. And nobody would ever put gasoline in their car if they knew there was a quality concern that might damage their engine. But unfortunately, in healthcare, we do that every day. And creating a consumer model that is accretive to quality was really the point of what we have been working on as an organization. So Jeff, I'll stop there and turn it over to our next panelist.
Thanks, Wally. I'll turn it over to Annalie at Eden Health.
Awesome. Thank you so much. Hi, everyone. My name is Annalie. I'm one of the medical providers and the clinical quality manager at Eden Health. This is such an awesome presentation. I think it's like so exhilarating for me to hear other people. I don't know about you guys, but I'm like kind of like getting ready in my chair to blast off and help provide better quality care for patients everywhere. But I guess I wanted to talk about Eden Health and how we are focused on quality. Eden Health provides more efficient care, has better outcomes, and is way less expensive. I wanted to start out by saying a simple fact that I think we can all agree on, right? Healthcare is complicated. And I realized this firsthand when I came to New York City when I graduated studying medicine. And I thought, wow, I cannot wait to start seeing patients and start being everyone's favorite medical provider and to make care seamless. But very quickly, I realized that the system was not only set up against patients, but also providers. I was given a revenue quota, right? I was ranked against my fellow providers. I was encouraged to see as many patients in as little time as possible, and encouraged to do follow-ups that I knew weren't clinically necessary. And, one day I was on my way home and I was feeling very defeated. I'd probably seen upwards of 60 patients in a single day. And the worst part about it is I don't really felt like anything I was doing was really valuable for the patients, and in some ways I felt like I was making them sick from a financial perspective, right? Generating claims on medical care that I knew wasn't necessary. And so I was walking home one day and I thought to myself, what can we do? And the idea of going direct to an employer made sense to me, because employers pay for their employees' health insurance, and employers want their employees to be healthy because they want them to work hard. So it made sense. Providing care direct to an employer for all their employees made sense from a cost perspective, but also a quality perspective. So that's what Eden Health is. We are concierge medical providers for employees everywhere. So you can see it in our numbers as well. If you go to the next slide. We have a mobile app where 85% of our encounters take place. This is generally over video or a text-based platform. None of these encounters generate a claim, so there's cost savings there with even better quality. I think everyone's been in that situation where, we're sitting for an hour or two waiting to see our medical provider only to find out our test results were normal, right? Why can't that be over video or over text? And when it comes to quality, we know accessibility is key. We respond to every patient message within 7 minutes, and that includes on weekends and holidays. I always make a joke that people don't get sick from 9 to 5, Monday through Friday, right? People get sick on New Year's and Christmas, that you need to be available for your patients even on those days. And it needs to be with your empaneled medical provider, someone that's familiar with your history, that knows you well. So we interact with our patients 4.5 times a year. And this is with your primary medical provider who knows your story, who's familiar with your history. And that makes outcomes better. It leads to more preventative care, which we know reduces healthcare costs. It leads to less specialty referrals and less time wasted. On average, we save our patients about $801 each year in claims generated. So we very much believe that the secret to fixing healthcare is quality, and Eden Health provides more efficient care, has better outcomes, and is way less expensive. But we don't stop there. Perfect. Great timing. We are accredited by the NCQA for being a patient-centered medical home. If you're not familiar with this accreditation, it is the highest quality of primary care. It's something that we take extremely seriously. And actually, when we went through the accreditation process, we actually beat the standards so much so that, you know, we didn't even fall into a criteria. For example, they wanted, you know, if a patient were to reach out, to have a response within 48 hours. And for us to tell them, you know, we do it within 7 minutes is something that beats their standards by a lot. And you can see how valuable it is to our patients. You know, they've told us that they won't leave their job because of Eden Health. And when has an employee really bragged about a healthcare benefit like that before? After each encounter, we ask for feedback from our patients. And right now we average 4.95 out of 5 stars. So I know I've said a lot of things. A lot of people always tell me, like, this seems a little too good to be true, especially with kind of what I've stated so far. So I wanted to take you through a patient journey. So this is a real patient. It's been de-identified, but let's call her Catherine. I met Catherine at a pop-up clinic. A pop-up clinic is when we come on site and provide direct primary care. We basically set up a primary care practice within an office's conference room. But she came in mainly because she had been experiencing a headache for about 2 to 3 weeks. It turns out she had been experiencing a sinus infection that was not being effectively treated, mainly because her primary didn't have time to see her, and when he was able to see her, that he didn't give her the time he needed in order to get the correct diagnosis. But you know, at this time, we realized that she had multiple conditions that weren't being effectively managed. She had thyroid disease. She was overdue for preventative imaging like a mammogram and also a colonoscopy. She had severe insomnia that was basically being treated with addictive medication that generally acts just as a Band-Aid and can make insomnia worse. But the most concerning symptom was really around her mental health. We think it's important to treat everyone's mental health just as important as it's to treat someone's physical health. We think you can't treat one without the other. So at every appointment, we screen every patient for depression and anxiety. And she was found to have severe depression, so much so that she was having thoughts that she'd be better off dead. So we were able to spend 45 minutes with her that day, collect her background, and also talk to her again that evening, the following day, and the day after that. And within a week, she was impaneled to a primary care provider. In this case, it was myself, but also a mental health provider that's within our practice so we can collaborate on her care. I discussed her condition with multiple specialists, making sure that the weight wasn't put on Catherine to go seek out specialty referrals, but that I took the initiative and reached out to other specialists that could consult on her care. And just within a week, you can tell what she said, the quote in the middle here. You know, this is the first time in my life that I feel like I'm getting the care that I need. And I think that's really what Eden Health does in the simplest terms. We give patients the care that they need.
Thanks, Annalie. Sean, I'll turn it over to you.
Yeah, thanks, Jeff. Good morning, everybody. It's great to be here today. And I'll give you a quick little bit of history of Edison and kind of how we got to where we are today, and then dive right into this a little bit in the core of who we are. Edison was founded about 10 years ago by a guy named Tom Emmerich, and Tom was head of global benefits of some really big employers, British Petroleum, Diageo Foods, and then his claim to fame, so to speak, was with Walmart. And he was responsible for running Walmart's plan for years and years and years. And he was the architect of the Walmart Center of Excellence program that's pretty popular today. He's got a lot of notoriety. And it was really focused on 2 core principles. First and foremost, 6 to 8% of his population was spending all the plan dollars. So we know that to be true in all self-funded plans today. That small pocket of people are spending all your money. Second, we have an absolute epidemic of misdiagnosis and overutilization and inappropriate care in healthcare in America. This speaks to a lot of that. So what ultimately happened, guys, is Tom was super successful, saved Walmart billions of dollars just focusing on the 6%. And a bunch of employers started reaching out to Tom saying, hey, how can we get one of these? We don't have the horsepower of a Walmart to do what you did, and we don't have your expertise. And so Walmart, the Walton family, allowed him to clone the program, and that became Edison Healthcare. So focused on this epidemic of misdiagnosis, overutilization, inappropriate care. What do we know? Of that 6% of the enrollees spending all the money, 20% are going to be completely misdiagnosed, and an additional 40% are going to have wrong or suboptimal treatment plans. And you heard Jeff mention a few of the stats already. 6 out of 10 spine surgeries in Edison do not happen. 35% of all cancer in Edison is misdiagnosed. And I actually need to update that slide. Our data has gone up 5%. But that's a horrible thing to have misdiagnosed, guys. And I can't believe I've got story after story, week after week of this exact scenario. So you've been told you have cancer in your local market. Maybe you've started treating for it. You go through our program and you find out you don't even have cancer. That is really scary to think about, guys, that an oncologist can actually screw that up. But it's true. More often than not, it's wrong staging, wrong pathway, wrong cancer happens all the time, which is bizarre to me. But nonetheless, major issue. I won't read all these. You guys can see the other misdiagnosis stats, what we're seeing every day at Edison Healthcare. Next slide, please, Jeff. So what are we doing? We're a network of self-funded employers who lean on us for that 6%, the 6% of the enrollees spending all the money. We direct them in a concierge medicine model. Airfare, lodging, meals, or mileage are covered for patient and caregiver to go to one of our centers. It is truly concierge medicine, white glove, red carpet approach. And it all stems from these dots you see on this coverage map. These are our smart care centers. We are a PPO by disease, not by geography. I jokingly say that. I think PPOs might be the single biggest fail in healthcare in America. But nonetheless, I jokingly call us a PPO by disease. These centers have gone through our 15 to 20 month accreditation process. We are literally changing the way they do business. And it's huge. To speak to some of that, here's a nice summary. A lot of salary-based, multidisciplinary, because doctors are paid to cut. There's no accountability in healthcare in America. All of our surgeons, all of our clinicians are salaried. They're accountable to the center and they're accountable to us. Multidisciplinary diagnosis and understanding that there are other comorbidities associated with a spine issue, with a joint, with a heart issue. Maybe you're overweight, maybe you're diabetic, et cetera. So that's very important. All in a speed to care type of environment. Outcomes, we're constantly monitoring our centers, which is really important. We only work with evidence-based quality centers. That's a #1 criteria. What does that mean? There is zero chance I'm going to work with an education facility. I think university of this hospital, university that, Johns Hopkins, Duke, all those, they serve a great purpose. New technologies, research, experiments, whatever. They can do that on someone else. They're not going to do them on our patients. So evidence-based quality is a big deal to us. Patients are #1 on the list. Pricing, all of our pricing is case rated or bundled. Super important to delineate that. No percentage of this, no percentage of that is a flat case rate fee for everything that we do. We don't hang our hat on being deep discount, but our pricing is far better than what you're going to pay in your Buca network today. I don't believe in deep discount. I don't believe discount solves healthcare because who cares about a deep discount on a surgery you never needed? And the appropriateness of healthcare is what truly matters. We should be obligated to be priced right. But I get it. Healthcare in America is so discount driven. Unfortunately, it hasn't worked yet. So we might want to think differently a little bit on managing healthcare. Next slide, please.
Sean, that's the last slide I got for you. But
okay, awesome. Well, then I'm done. Boom.
I would love, you mentioned the team-based approach. I think it's fascinating. Can you share that study that you often talk about where they gave the same providers the same case files,
Yeah, that's a good one.
And talk about that, how that's shows the importance of your team-based diagnosis approach.
Absolutely. Yeah. So normally when I do my full deep dive in Edison, I kind of take the employer on this journey, if you will, of them realizing how much they're paying for things they should never be paying for, and then diving into that solution of that. And so I get to this point, and it was actually on that coverage map where I normally do it when I talk about our accreditation process. How is it that we're able to go on the hook for revisions? No employers pay for revisions in our network, period. Major issue with joints and spines. How is it that we have patient satisfaction so high? And it really comes down to those 4 pillars: the speed to care, the multidisciplinary, the fact that our doctors are salaried, they're not paid to cut. But this 4th pillar is what Jeff is referencing. We will never allow a single clinician or their multidisciplinary team to determine a diagnosis on their own. They are required to double, triple, and quadruple check their diagnosis pathways before a board of their peers that we have set up for them, we have selected for them in conjunction with them. We do that for what Jeff just mentioned. Mayo did a study a few years back. They brought in several hundred of the best clinicians in America of all varying disciplines, brought them into Rochester, Minnesota for a blind or independent study, gave them all imaging, pathology, labs, whatever they need to come up with a diagnosis. No idea who the patient was. They came up with their diagnosis, they left, they came back 90 days later. Unbeknownst to them, they were given the exact same patient and told to come up with a diagnosis. And I bet everybody on this call today knows what happened next. Over 43% of the time, the same people change their diagnosis just in a 90-day period. So what does that tell me? It tells me that we're all human. I don't care about your education. I don't care what school you went to. I don't care what U.S. News and World Report says about you. You've got to have checks and balances in place to ensure proper pathway. And that truly is the secret to Edison's success. It's why we've grown at the rate that we've grown, is truly that.
Thanks, John. I appreciate that. And thanks to the panelists for sharing some more insight into each one of their companies. Feel free to ask questions along the way. But in the meantime, I have some questions of my own for the panelists. So I'll give this one to Wally to start it off. What's the biggest misconception among employers regarding the quality of healthcare?
So Jeff, I kind of flew through that in the beginning. You know, I believe that we have 2 misconceptions from the employer-sponsored lens. You know, one is that all providers are the same. You know, and I, come from a family of physicians, so I'll say that physicians are no different than when we were all back in school. You know, there were some students at the top of their class, some in the bell curve, and some we kind of wondered how they made it from the last grade. We get asked a lot of times, would it make sense for us to go to this high quality facility or this high quality facility? And, our response is yes, but you're not asking the complete question. It's not only should you go to this high quality facility, but what physicians do you see when you get there that matters? So the fact that there is a difference is probably the biggest one. The second is that we've, again, on the facility side, have always thought about hospital systems as either being all high quality or not. Every hospital has some service lines they're great at, some they're okay at, and some that they send their own family members somewhere else if they have to have services. And any hospital executive would tell you that if you could get them, alone and to sort of, speak honestly. Knowing where the best quality is not the challenge. How we get individuals to take advantage of that is really, what we believe, the bigger lift that we've been trying to solve for. We can call it engagement. We can call it whatever we want to call it. We have just found that if we create a consumer strategy where individuals make consumer-based decisions like they would buy anything else in the world, people will lean in. The reality is Americans are great at being consumers, but only when they have the information.
Sean, what about you?
Yes, so I echo a lot of what Wally says. I think there's a massive assumption that the doctors are just getting it right. It's a massive issue in healthcare in America. I think also associating low cost with quality is a monster fail. I think we should be absolutely obligated to be priced right. You heard me say it. But, don't make decisions based on the lowest cost provider. I will say I do think it's difficult to determine quality if you measure quality the way the way that we do it. But entities like SimplePay and Edison are able to find those things because they have the metrics to determine it. But the regular consumer, the regular employer has no clue. They figure I got this awesome Cigna network, Buca network, whatever, and they've got to be good. Why would a carrier allow that in there? And so I think that's a big issue. You can't assume these places are getting it right. And to Wally's point, even our smart care centers, we don't have a single smart care center that does everything. It could be a very specific thing. For example, I only allow Cleveland Clinic to manage valve repair patients. That's it. Nothing else there. I only allow Mayo to do transplants and some other complex things. So Wally's absolutely correct. You've got to get granular. You've got to get under the hood of these centers and understand what they're doing, understand what these providers are doing. Checking the box is an absolute waste of time. These accrediting bodies that come in and they have this long list of stuff to do and they go check, 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 check. You know, you're a center of excellence. Congratulations. It's a load of bull. You know, you've got to get under the hood and really understand how they're executing on that quality.
Mm-hmm. And Annalie, what about you? What's the biggest misconception from your perspective?
I think, you know, something, and I agree that you should really be getting into the nitty gritty and the details and really kind of understanding everything under the hood. But I do think that you can also in some ways be rather simplistic about it. I think something that we don't do very frequently is ask people, you know, how are you feeling? There's a lot of data around, you know, a self assessment of your health and asking someone like, how would you rate your overall health? And there's some data that actually supports that. That's one of the biggest questions around someone's quality of care and quality of life. I think when you talk about quality of healthcare, I think you also need to talk about a quality of life as well. And I think something that we don't frequently do directly to our employees is ask them, how would you rate your overall health? How would you rate your quality? And I think you have to give people and patients in you know, in my field, some of their kind of own ability to assess themselves. And I think people really have a great way of saying, you know, I don't think that's the care that I need, or, you know, I do think that's the care that I need. And you have to trust that their instincts can also be right. So I think, you know, being simple about it and saying, you know, like, how are you feeling? How would you rate your health right now? What do you think you need out of care? And then
Thanks, Annalie. So I got one question came through from the audience, and I will go ahead and read this, and then we'll see what you all have to say. There seems to be a big price difference in hospital imaging and outpatient imaging. How do you measure quality in imaging, and how can you reassure an employee that they are not being redirected at the expense of quality for the employer to save a cheap buck? I'll share my perspective, and I'll ask you, Wally, to follow up. I would say that there's some things that are just commodities. In my mind, imaging is a commodity. It's the same exact machine, but if you go to Atlanta Medical Center, it costs $450, and if you go to Northside Hospital, it costs $2,600. But Wally, I'm curious your perspective on the imaging piece. But then the second question I think is even more important. How do you convince employees that it really is quality and it's not just cost?
So Jeff, I'm going to talk in terms of quality and efficiency as it relates to this specific question. And even in a situation like high cost imaging from an MRI image, there's still differences in quality. We measure MRI image quality through the magnet strength of the machine. The GE scanner is measured in Teslas. I live in North Texas. I can get an MRI of the brain done at a hospital system for $640 with a 3.0 Tesla magnet. And I could go to another branded facility across the street, and I'm paying 4 to 5 times more for a lower quality image that has a lower magnet strength. And again, even as we look at MRIs, we also have to look at the radiologist that's going to do that interpretation. Most of those radiologists are looking at that image at home on their computer. There's really generally not a difference in that physician component. I think the other part really builds on what Sean was talking about. We've got to look at efficiency. When we look at ologists, you know, maybe you're looking at, you know, a cardiologist, an oncologist. In this case, let's say it's an orthopedist. There are very significant differences for the identical patient episode in terms of the physician that's going to order high cost imaging versus the physician that's going to order, you know, alternative therapies like, you know, maybe it's an X-ray or maybe it is, you know, physical therapy. Why one physician would order 4 times more high cost imaging from another kind of goes back to what Annalie was talking about in terms of, you know, being put on basically a quota to create so much patient revenue and volume. We've got to not only look at quality, and yes, there's a difference in quality, and even in something like an MRI, and we have to look at the utilization rates if we're really going to get to a place where we can improve the performance for the plan sponsor and the patient.
Thanks, Wally. That's great. Learn something new every time I talk with you. I'll give this one to you, Sean. Similar to the first question, but what's a commonly held belief in healthcare that you passionately disagree with?
Yeah. So it is sort of like that, right? Massive assumption that there's a center of excellence in every major community in America, and that you can saturate a network and have lots of choice and have lots of quality. It doesn't exist. It doesn't exist. And I'd say that is probably the number one thing that I passionately disagree with. You saw our center, our smart care centers around the country. That was some by design to be geographically relevant, but that was more, there's just not a lot of great out there. And Wally happens to live in a state, he just mentioned it. There are some cowboy doctors in that state, no pun intended. And, you know, I don't have a single smart care center in that state for the very thing I just said. Haven't found one that is doing it the right way. So that to me is probably the biggest thing.
Annalie, what about you? What's one commonly held belief in healthcare you passionately disagree with?
Yeah, so I think, you know, this kind of response just came into my head when I read this, and I think it's as simple as like the experience doesn't need to be bad. I think we all kind of go into a health experience, and whether it be I have to go to the dentist, or I have to go see my orthopedist, or I have to go to a physical therapist. It is a commonly held belief that the experience is going to be bad, right? You will have to wait a long time in the waiting room. You won't get enough time with your provider, and you'll likely get a bill in the mail that you weren't expecting, right? I think we are paying a lot of money to get the healthcare that we deserve, and we don't get it. And I don't think that we should really stand for it any longer. And I think that's what we really need to focus on, that, you know, it doesn't have to be a bad experience to get good quality care.
That's right.
That's great. Wally, I was thinking of you when I wrote this question. I thought you'd appreciate this one. It's the year 2025. What was the most significant change in healthcare over the past 5 years?
Oh, I think I could say it depends what happens next month after the presidential election, but let's not go down that path. You know, I do believe we are on the cusp of everybody moving away from price transparency to quality. Quality, and I know this is a big statement, in our opinion, and I think all three of us, all four of us, you know, as speakers today would all concur, is the greatest untapped opportunity in medicine. There is such a large difference, but because of the way that insurance networks have been designed, we've never been able to really purchase around quality the way that I believe we're moving towards as an industry. And I can't imagine 5 years from now, regardless of what happens on the legislative front, that quality will not be viewed as the primary way decision-making is made in healthcare. There are just too many organizations that are working and sprinting towards that. And even the BUCAs, the national carriers, you know, recognize that really needs to be the step we go in. You know, I'll tell you a quick story. I just think sometimes the stories bring it home. You know, I was talking with a consultant in Ohio whose brother is a neurosurgeon. And he said, look, I'm going to see my neurosurgeon brother for a family get together. Could you pull for me his quality rating before I see him? And I was like, oh no, this might not go very well. And sure enough, his quality scores were not strong, and not because of his performance, but the facility that he was admitting his patients to had an over 400% higher rate of infections than their peer group. We shared that data with that surgeon, and that surgeon said, you know what, I had no idea. I guessed, but I really didn't know. I'm going to start admitting my patients to the facility that I also have admitting privileges to that performs better. And now we're working with that underperforming hospital to help them shore up their results. We're not a hospital hater. We need to help those providers be better. And that to me is the kinds of things and the bar that is going to, I hope, be raised for us as an industry. That was a long answer, but that's where I think our world is going.
One follow-up on that. So obviously the providers and hospitals are a sizable lobbying force in our nation. What's the impact or backlash of the bottom 75% of providers and facilities realizing that they're being steered against? How do they respond to that?
So again, our organization's approach is not to be a hospital hater, but to actually find ways to improve hospital performance. We do that in two ways. One, we got them out of the banking business. They never have to bill, collect, and deal with medical bad debt ever again. Let them focus on practicing medicine. That's what they need to focus on, not be in the patient collection business. So we remove them from that. The second part is there is not a hospital in the country, I say that, almost factually, that doesn't have some service lines where they're at least at the peer group level for high quality. Every hospital generally has services, again, that they're great at, they're okay at, and some not so much. And so again, our goal is, to try to steer to those service lines. Those hospitals know what they're great at. And we actually have a insurance strategy that automatically and naturally steers patients towards that. So hospitals have been very enthusiastic over the work we're doing with them, but they're not going to get all the patients because they're not great at everything.
Sean, anything you would add to that?
Yeah, I don't care about that bottom 75%, honestly. If they're bad, they're bad. And that's okay. Just to give you some context, in the state of Indiana, I've got a lot of employers there. I think about 40 to be exact. A lot of self-funded employers in that state that access Edison. Why? Because their cost of care is through the roof and their quality is awful. And so I sat in front of a major hospital system there in Indianapolis, and they were doing the typical executive hospital type of thing. They flex and tell me how awesome they are and how great they are, and that, we need to be in your network and we already do everything great and we don't need to go through your accreditation process. They were a little more eloquent than that, but that's what they were saying. And I was a little more eloquent in what I'm about to say. I basically said, you're either going to go through it or I'm taking every employer out of your state and you'll never see them again. So I said it a little bit nicer than that, but I'd rather be more blunt on this in this meeting. So, tough, get in line. That's where we're going to be in the year 2025. Wally's absolutely right. Deep discount has not worked. Tell me one thing in healthcare where that's worked and everything's peachy and great. It doesn't work. So be priced ethically, be priced correctly. It should be an obligation. But who cares about a deep discount on a spine surgery you never needed to begin with? And so Wally's absolutely correct. Year 2025, it's going to be more about quality. Employers are going to go direct to Eaton. They're going to go direct to Simple Pay. They're going to come direct to me like they're doing. And they're going to say, screw you, Buka, I'm done. And that to me is where it's going. And you see the carriers actually diversifying their business lines because they know they're losing their business. It's a fact. United has diversified significantly. Aetna has diversified significantly because they know in the next 10 years, they're going to look very, very different. So.
Thanks, Sean. I always appreciate your candor.
Yeah. Sure.
Annalie, love to hear your perspective as well.
Yeah, I think, I had a really great mentor when I was studying medicine. And I feel like he taught me a lot about basically like the art of medicine. And I think, we all spoke about kind of like how, you think like medicine is black and white, and it's not. It really isn't. And it's really up to the medical provider that you see. But anyway, he really taught me these really great history taking skills on how you get to know patients and really kind of grow relationships with them, because they are relationships. And I think, being a part of a telehealth platform, mainly we do have physical offices, but I think what COVID has also done is kind of accelerated medicine into the 21st century that has needed to happen for a really long time now. But I guess this is a really long-winded response to this, but I think in year 2025, we will be basically moved to telehealth, more focused, and encourage people that you don't need to see people in a physical room, that you can see people over a video or over email or over phone and get to the correct diagnosis. It's all about really putting things in the best place of care, whether that's in person, on a video call, or on a text-based platform. But I think hopefully by year 2025, that we will kind of move medicine into the 21st century, hopefully.
The less, from my perspective, the less I have to go to a doctor's office, the better. So I love to hear that. I'm gonna skip this one because I feel like we've all touched on it. Sean, let's start with you. When in your career was the light bulb moment for you regarding the importance of quality?
Yeah, good question. So Tom Emmerich, our founder, guy that ran Walmart, the whole thing I led with earlier, has been a great friend and mentor of mine for, golly, 15 years now. And I mean, I've been in the workforce for 24, so a good portion of my growing up in healthcare came from him, and understanding employee benefits and the importance of quality. And you know, my career went off several different directions. I've got my own companies aside from Edison. Acquired Edison in fourth quarter 2017. But I think the light bulb for me really hit is when Tom called me in 2015 and asked me to help him grow Edison. If one of my companies would put some horsepower behind Edison and help it grow more than it already had. And I really got under the hood. Tom passed on his proprietary accreditation process that we do for these centers. And it all centers around quality. Everything leads to that. Everything we do from a cost perspective, from a product perspective, from a workflow, patient experience perspective, all circles back into quality. So that light bulb has always kind of been there because he's been in my ear pretty much my whole working career. But really applying it and living it, 2015 for sure.
Wally, what about you?
So I have not talked about the brains in our operation. Is a gentleman named Scott Shainvogel. He's our president and co-founder of Simple Pay Health. But Scott's, you know, also got a similar story as I have with Sean. Scott was the CEO and founder of Compass, now branded Alight, one of the country's largest patient navigation businesses. And Scott's gifting is being able to, you know, take in very, very large, you know, blocks of claim and quality data, and then be able to utilize that information, you know, to glean new understandings. Initially, Compass's focus was around trying to navigate for the best price tag inside of an insurance network, which made a lot of sense when high deductible health plans came into law. What we started to realize, and very consistent with, you know, with Edison's, you know, philosophy on this, is that price tags, I won't say that they don't matter at all, but they pale in comparison to looking at things around quality, efficiency, referral patterns, and outcomes. That's where the big dollars are. And those dollars are the result of better outcomes, better patient care. And so for us, you know, our pivot away from unit cost is, you know, towards quality is the reason we created Simple Pay. And, you know, in today's world, you know, while discounts and networks don't matter, they still matter, you know, from our perspective. The RAND study that came out a couple of weeks ago, I would commend that to all the audience on the line today. The percent that we are reimbursing on average as a percent to Medicare is gotten to a level that's not appropriate. And again, we don't need to buy $10 gasoline when it's $2 across the street and it's higher quality. We just have to take advantage of the information that's available and use it.
Annalie, what about you? What was your light bulb moment?
Yeah, so I think, you know, a good one was when I first started out. I know I told the story about how I was, you know, seeing upwards of 60 patients in a single day. And what was also happening at this practice, which is very frequent, it happens a lot of the time in the emergency rooms and other private practices, but basically when a patient would come in, they would immediately have tests that were associated with their name, right? every woman came in, they would get a urine dipstick and a pregnancy test. They would get a whole slew of labs. And, I thought to myself, like, why did I go to school for so long if everyone's getting the same recipe, right? So I think, what I realized is that we need to commit time to patients, and these quality metrics, this is something that has evidence around it, right? We're not making this stuff up, like there's reasons why we have different quality metrics and evidence to support why we should do one thing for one person, but something else for another person. So, I think what's really wonderful is that here at Eden Health, we can take the time that we need because we are quality focused, right? We're outcomes focused to know that, okay, this person does need a pregnancy test and this person needs that type of blood work. And we have that time, and also the revenue is focused on the quality. And I think that's another important piece, that when you think about, why we do certain things, it is really only about what would be best for the patient. What evidence supports that we should do this? So I think, this is how I found myself at Eden, right? This like light bulb moment that we're talking about here, that every person is different and every person requires different care. And you really need to take that time to create these personalized care plan from person to person based on evidence-based recommendations.
Well, thanks guys. This has been awesome. We have time for one more quick question, lightning round. If you had to condense our discussion today into 4 or 5 words, what would they be? Wally, go to you first.
Gosh, that's a hard question. I would condense it down into to say that the greatest opportunity, the greatest untapped opportunity in medicine is around quality. I've said it before. I'll just use that as my final statement.
Love it. Sean?
Stop paying for things you should never have to pay for.
And Annalie?
I don't know if I can say it through, but I feel very exhilarated by this panel. I think as a medical provider, I very frequently feel like I'm like, one person working against thousands of other medical providers. So I feel very exhilarated by this.
There are others out there. So I'm glad we could do this. Thanks to Espen for allowing us this forum to share some insight around quality. Thanks to the panelists. I think it was a great discussion. If you're interested in either of these vendors, you can find them all on the internet, or you can ask myself or Michelle, and we can connect you. With that, I will kick it over to Michelle for some closing thoughts.
I'd like to thank you all very much for your time today. We appreciate the input. I'd like to remind everybody that we do have our next webinar coming up on October 29th. Please join us for that. And with that, I hope you all have an amazing day and happy Friday Eve, and wishing you all the best this Friday and this weekend. Take care.
Thanks, Michelle.
Thanks, guys.